Breast implant exchange is another procedure that is done very often in plastic surgery. There are a lot of reasons why women get their breast implants exchanged. One of the more common reasons is that initially they had saline breast implants put in back in the early 2000s before silicone implants were fully on the market, and they'd like to get them exchanged for silicone gel implants. Another reason is that they may have capsular contracture, and this is where the scar tissue that forms around the breast implant can get thickened and hard and calcified, make the breast very, very firm. In that case, we take the breast implants out and the capsules and we put new implants in. Other reasons include increase in size, decrease in size, and change of position. There are still some surgeons that put implants over the muscle. I'm really not a fan of this. I believe putting implants under the muscle is the proper way because it reduces your risk of getting capsular contracture. So if implants are over the muscle, when I see a patient and they would like the implants exchanged, I take them out from above the muscle and then put the new implants below the muscle.